Hey, it's Dr. A. Want to do sort of a quick video about hyperbaric oxygen therapy and a couple of things about that particular therapy. I've been teaching and researching in the world of integrative naturopathic medicine for over 30 years now and been practicing a long time, and I use a lot of integrative modalities, hyperbaric therapies being one of them. So I just want to get into 5 of the more common reasons hyperbaric oxygen therapy may be used. Of course, there are many, many reasons. We're not going to get into all of those, but I want to just get into this because a real common question is, I've heard about hyperbaric oxygen for diving accidents. Why would we use it for, something in outpatient medicine, for example? So the first thing is hyperbaric oxygen is you going into some sort of pressurized chamber, and then there is a mixture of gases being delivered into the chamber. That might be room air under pressure, it might be oxygen and other gases, or it might be oxygen totally put into the chamber. What that does then is it increases the plasma saturation and the tissue saturation of oxygen beyond the area of your cells and through your skin and all of that business, so that it goes beyond what you can normally deliver through your red blood cells. But 5 of the things that it helps in cases that are used primarily in outpatient medicine. So we're not talking about dive accidents and things like that. The first one, which is not uncommonly done even in hospitals, is healing after surgery. In certain cases, this is even covered by health insurance. Not a lot of outpatient hyperbaric is covered by health insurance, but sometimes it is. And in the hospital, sometimes hyperbaric is used in healing after surgery. It could be because somebody maybe is diabetic, maybe somebody is elderly and a little bit, slow healing or some other reason. Now, what you need to know about healing after surgery is even if you're young and otherwise relatively healthy, you might use outpatient hyperbaric medicine to help speed up your healing, or if you're just having delayed healing, it can be helpful there. The next is in mitochondrial dysfunction. Now, mitochondrial problems, we have a ton of content on the channel about it, but as you probably have heard, mitochondrial things come in sort of the name brand genetic diseases where mitochondria don't form and operate correctly, and then all the rest of mitochondrial dysfunction, which is a functional problem usually, which is, a million things. But in mitochondrial problems where you see in fatiguing illnesses, in non-healing problems, in brain fog, and many other things, the mitochondria are what make the energy in your cells, and they're very responsive to the pressure of oxygen inside of your body. So if hyperbaric is able to deliver not just the oxygen being delivered off your hemoglobin at the side of your cell interface, but also your blood plasma has more oxygen, tissue has more oxygen. You're going to deliver more oxygen in. That's going to make the mitochondria work faster, which can speed them up. And it can also help the end product of mitochondrial respiration, part of which is taking the junk out of your cells. So mitochondrial and cell maintenance things. Quick interruption from the regular video. If you are a healthcare practitioner and you have an interest in this topic, we're going to put a link in the description below to my CE website, and specifically the webinar that is about this topic. So see you over there. Thanks. Brain function. There's a lot of research in the world of mitochondria function in the brain and its connection to the hyperbaric environment and oxygen. What we see in brain and neurological function is not only nerve healing, so you'd see that like with surgery or damage, through trauma or something like that, but also improvements in brain function that might be related to brain fog, memory deficits, other, insults to the central nervous system, like traumatic brain injuries. So you can have lower grade mild traumatic brain injury, higher grade TBI, post-concussive syndrome, and then all of the memory and other cognitive syndromes, big area for hyperbaric medicine. Then there's quality of life around cancer. And a long time ago, it used to be believed that hyperbaric oxygen would trigger cancer growth. And that has not been something that's in any published research for many, many years at this point. But that idea is held in a lot of people's minds. The idea was, well, oxygen might promote the growth of cancer, and so we shouldn't do hyperbaric oxygen. It turns out that hyperbaric oxygen actually is going to help turn on the biochemical switches that are actually anti-cancer, but also can help with a lot of the healing phase of cancer recovery. So in our practice, we get a lot of people who are done with surgery or chemo or radiation or whatever for their cancer, but they have a real hard time healing afterwards. For example, we will often use, among many other things, hyperbaric oxygen therapy to help their body recover and help them kind of come out the other side. Very, very useful in quality of life measures, healing measures, and even in the world of secondary prevention with cancer and cancer therapies. So the big five, although there's many, many others: healing after surgery, improvement of mitochondrial problems and disorders, general brain function such as memory problems, brain fog, etc., brain trauma syndromes, TBIs, MTBIs, post-concussive illness, etc., and then quality of life and healing around cancer and cancer treatment. All right, I'm Dr. A. Thank you, everybody. Please like, share, subscribe, and I'll see you all on the next video.